Doug, the sanitary crisis in Brazil is being seen as a man-made disaster. And the man that many Brazilians are blaming is, of course, the president himself.
Yeah, to the extent that this can be pinpointed on the mismanagement by one single figure, Bolsonaro is the target here. Look, the man has participated in at least 84 mass gatherings since the WHO declared a global pandemic last year. Mass gatherings, which are just that, inciting people to come together, not encouraging them to socially distance, not encouraging them to wear masks, and not encouraging them more recently to get vaccinated, not encouraging local officials who were inclined perhaps to do so to impose lockdown measures in order to get the numbers down in their particular regions when they were seeing the numbers spiking. So at almost every step of the way, Bolsonaro has not just downplayed, minimized the gravity of the epidemic, notoriously calling COVID just a little flu at one point. He has done everything possible to limit the degree to which local officials could have containment measures. He has not had a federally coordinated policy. It is not by coincidence, Thomas, that Brazil, just on Friday, June 18th, had nearly a third of all COVID deaths in the world. Let me repeat that. A third of all COVID deaths on planet Earth were in that one country as of last week. The cases have doubled in the last 6 months to that 500,000 plus now fatalities. And in just 1 year, 10 times more cases of COVID. This is going exponentially. It's not just that the cases are going up, deaths are going up, it's going up meteorically.
Now, Doug, a Senate investigation has been, of course, busy probing the government's response to this outbreak. What more do we know about that investigation?
Well, we know what they've been trying to investigate, and we also know about the blowback from Bolsonaro, who says he sees this as just political scheming against him. What the Senate has been probing, the Parliament inquiry, has been looking into the long delays in rolling out vaccines. What is that about? What is it with all of the talks between the Brazilians and the drug makers, looking into the details of the talks that the government administration of Bolsonaro held with these pharmaceutical companies. There are reports that Pfizer at one point offered a lot of its vaccines at half the price that it offered these vaccines to the United States. What happened there? Obviously, there was no uptake. There's also a look at a policy, a deliberate policy as it's seen by the Bolsonaro government to both promote the efficacy of unproven drugs such as hydroxychloroquine, which also briefly was popular here in France, rather than subscribing to the one thing that all scientists said did work, which is vaccines. So the Senate's looking into all of those things. It's an inquiry which began in April, still going.
And Doug, finally, let's look at those figures once again. We're now at over 500,000 deaths in Brazil. Just where do we go from here?
Keeps going up, according to the epidemiologists and according to the scientists, barring a dramatic reversal of policy. Those protesters would like to see Bolsonaro out. Barring either a change of policy or manager or management, if you will, in the absence of a mass vaccination program and a concerted, harmonized federal vaccination program, you are going to unfortunately see these numbers keep rising. Some of the local health officials, epidemiologists, are saying that it could get up to 700, 800,000, which would catapult Brazil ahead of the U.S., which is at around 600,000 cases of deaths from COVID. The problem here is about just over 11% of the Brazilian population has been vaccinated with both doses. I think it's something like 20% in the 20s with one dose. It's extremely low. You have to get to a minimum of 40% of the population. The epidemiologists will tell you that's a bare minimum to have any chance of fighting this. Otherwise, the variants keep on coming. The Indian variant was there. The Amazon variant was there. And they just keep getting stronger and more virulent. And there's no way of warding them off in the absence of a good, effective vaccine campaign.
Okay, Douglas Herbert, thank you very much.